I wondered, have there been many people asking for treatments that are outside the scope of the Pharmacy First scheme?
GPs can refer patients to us under the minor illness umbrella, which includes a lot more conditions than just those seven pathways. So we are seeing more things actually in pharmacy than we've seen before. But to be honest, since the COVID pandemic, that's been happening too, because people just learned to use pharmacy in a different way. And I guess that's really good because there's a lot of things I can help people with. I have the clinical knowledge and skills, and we have a plethora of products that people can maybe buy over the counter for supporting their symptoms. And obviously now we have the PGDs. So we definitely have seen lots of different things. And what that really helps us with is to really help to filter the things that we can sort out and the people we can help versus the ones we can't. And I guess with all the training we've been doing, we're doing a lot around red flags and a lot around those sort of serious conditions. And that's been really helpful to us to really think to ourselves, are we dealing with a common condition here? Or is this a really uncommon presentation of something that just doesn't feel common and simple and minor illness? And so I think what we're developing is our own kind of pharmacy radar and our own kind of way of understanding, which patients can I help, which patients can't I help, and actually which patients could I maybe help for a few days and let's see if it works, but actually give them support to know how to get back into the NHS if they need to, if things don't work out. So definitely we're seeing a different range of patients coming through. And, with all the advertising, promoting people to go to Pharmacy First, people are trying their luck saying, I've just broken my thumb. Any chance you could have a look at it? And I, feel like saying, yeah, step into my X-ray machine. But it's quite amusing. But it's interesting to see what patients want from us. And I know I had one patient when I was talking to her in my consultation room about Pharmacy First, and she said, "Oh, Reena, you've been my best kept secret for a long, long time. Whenever I've got a health problem, I can just come and talk to you." And she said, "I hope you don't become so busy that I need an appointment to come and see you." And it was really interesting that she said that, because for patients who are in the know, pharmacies are the best kept secret, because we really can help people sometimes when they don't know what to do, or we can help them signpost to where they may need to go. And so I think there is a really important role there for pharmacy in that primary care navigation.
Mm. And how have local GPs reacted to the service?
On the whole, the majority of my GPs have been really, really supportive. Many have said, come and spend some time in our clinics. We'll help you look in people's ears to get you more comfortable with doing things like that. They want to work with us so that we make sure that they send the right patients to us, and then they work with us in case we need to escalate a patient back. So my sort of 3-4 surgeries that I work with closely locally to me have been absolutely excellent. There's always going to be practices that don't want to adopt this, that feel they can manage on their own and, struggle to adopt the referral mechanism. And so I guess we just chip away at those slowly. But for the ones that are really on board with it, they're the ones we want to run with. They're the ones we want to support. They're the patients we want to look after. And so on the whole, it's been a really positive experience.
Good to know. And as a result of your experiences, what tips can you offer to colleagues?
To colleagues, I think this is a change, and change is hard. And there's a lot of change in pharmacy, and it's not like we're sitting twiddling our thumbs and our day job is easy. And so I think my message to colleagues is think differently about your team, think differently about your day, think differently about the services you offer, and how many of those support the actual agenda of the business. So I'm thinking about my team in particular. I have a dispenser who I'm training up to become an accredited checking dispenser, which will allow us to have a bit more free time to be able to offer these consultations. I'm thinking about my pharmacy and my day, and how can we make Pharmacy First consultations fit into our day. So we've decided to do appointment systems between 10 and 12, and then 2 and 4 where we can. Because then we know where we stand. If people have referred to us, we can put them in those slots. We know that in those 2 hours, we may have some clinics, but actually the rest of the time we can do some of our other pharmacy work. And then I guess also about the premises, thinking about, is that one consultation room enough? Do we need to think about a different model of working? Is this now, the time to invest in maybe expanding the premises or changing the premises to be more fit for the future?
Useful tips there. And my last question, what would you like to see happen now?
Well, it's interesting. In other countries, Scotland and Northern Ireland and Wales, they have a lot more conditions that they can treat using their Pharmacy First service. So obviously, I'd like to see the parallels of England match Scotland, which I think has the most, and really see the expansion of Pharmacy First. I think we need to embed a few things to get that expansion in. One is IT. And if the IT systems are integrated, that allows us to have such a better working kind of experience of Pharmacy First, and it's safer for our general practice colleagues as well who may be referring into us. So I think that's really, really essential. The second is the confidence of the sector, the confidence of community pharmacy teams to deliver on this. You know, with every new service, there's change. Change is always hard. We need to make sure that everybody's on board and everyone's doing a good job and providing a good service before we really add on and bolt on more. But thirdly, I think one of the most important things is in 2026, we're going to have a new breed of newly qualified pharmacists who are coming out as independent prescribers. And my biggest concern is that they're going to come out and work in community pharmacy and then not be able to use their skills. And if they're not using their skills in community pharmacy, guess what? We've lost our workforce. They're going to go work somewhere else where it's sexier and easy and possibly easier, because our day job is pretty hard in community pharmacy, and they're going to look for the places where they can use their skills and their skills are utilized to the max. So actually, it's in our interest to do well with Pharmacy First. It's in our interest to do well with all the services and to really show how we can safely supply using PGD so that we can hopefully move that to independent prescribing, allow a supported clinical decision-making model in community pharmacy, which allows us to, you know, support differentiated diagnosis of lots of different conditions. And I think that would be the future because of our future workforce. We can't afford to lose those people. And community is the biggest employer of pharmacists, you know, across the whole profession. And if we start to lose that because we're not able to offer services that match the skills of our future workforce, then we're in trouble.
Reena Barai, thank you very much for talking to us about the Pharmacy First scheme and sharing your experiences. We look forward to hearing how this develops further. For more about Reena Barai's work, please visit our website using the links in the description, and be sure to subscribe for more news, videos and journals. For updates straight to your inbox, please follow the links below. And thanks for watching.